Hello everyone, welcome to another MCQs practice session from the topic oral pathology and medicine. Let's start with the today's workout. A progressive increase in mandibular length and in mandibular interdental spacing in an adult patient is characteristic of hyperpituitarism, periodontosis, hypothyroidism, hypoadrenalism. Increase in mandibular length is also seen, so it is hyperpituitarism. Gigantism in children and acromegaly in adults are due to hyperpituitarism. A child came to your clinic, have leukemia, number of neutrophils are 1400 and want to extract his primary central incisor. Will you treat him? As usual, patient, give prophylactic, give platelets before extraction, do not extract. If the neutrophils are less than 2000, no dental treatment. That is correct. The characteristic appearance of rash as seen in the color plate is associated with which of the following? It is butterfly rash present and it is characteristic of SLE. Systemic lupus erythematosus. Some microorganisms produce a diffuse spreading inflammatory reaction due to the elaboration of coagulase, peroxidase, bradykinin, hyaluronidase. It is hyaluronidase. Most streptococci produce hyaluronidase, an enzyme that dissolves the hyaluronic acid and helps in spread of infection. Which of the following? Primary enamel hypoplasias, amelogenesis imperfecta is primarily or disturbance of ectoderm. The given OPG suggests the diagnosis of, here the third molar is impacted, familial gigantiform cementoma, florid cementosseous dysplasia. Florid cementosseous dysplasia is the correct answer. Given OPG shows multifocal involvement of mandible showing mixed radiolucent radioopaque lesions. Though this is not so clear. Another name for a dentigerous cyst is dental radicular follicular primordial cyst. Dentigerous cyst is follicular cyst. Yes. In which of the following disorders a circulating antibody directed to intercellular cementing substance of stratified squamous epithelium is observed? Intercellular means it is pemphigus vulgaris. Which of the following is not a clinical feature of Pierre-Robin syndrome? Micrognathia, it is seen. Retrognathia, glossoptosis, coboloma of the lower eyelid. Micrognathia, retrognathia, and this is seen. Coboloma of lower eyelid is not seen. A tooth with a 3-month history of pain, which was worse when hot liquid was in mouth. After extraction, the tooth was split open. The pulp chamber was completely filled with pus. Few remnants of pulp tissue were found in apical end. The condition is suppurative pulpitis. Open bite in a bright and intelligent child of 8 years. There is no intellectual disability. Worsening progressively with no history of thumb sucking or tongue thrust. Deficient molar bones. This should be malar bones, malar cheekbones. And difficulty in hearing. It is suggestive of Treacher-Collins syndrome. It is most commonly found in lip, gingiva, tongue and hard palate. It is found in lip. Which of the following gene is involved in odontoblastic differentiation? MAP1, P53, PLAG1, FEX. Odontoblastic differentiation is MAP1. Odontoclasia is linear enamel caries, cervical caries, and root surface caries, nursing bottle caries. Odontoclasia, it is linear enamel caries. Dental fluorosis can cause all except mottling of enamel, calcification of ligaments, dental caries, intrinsic stain. Dental fluorosis doesn't cause dental caries. Which among the following is the most common complication of mumps? Orchitis, conjunctivitis, uveitis, myocarditis. Orchitis is a commonest complication of mumps. A 40-year-old male patient reported with a lesion which is present since past 1 month. It is tender and does not fade upon compression, which is the most probable diagnosis. Pyogenic granuloma, lipoma, hemangioma, pericoronal abscess. It is tender. Pyogenic granuloma. Identify the pathology. It is bifid uvula. Which of the following is the difference between herpangina and primary herpetic gingivostomatitis? It is preceded by prodromal symptoms, unilateral in nature, seen on the anterior fascial pillars, viral etiology. Although herpangina is seen in anterior fascial pillars, primary herpetic gingivostomatitis may involve all the gums and even lips. Differences occurs in epidemics, anterior fascial pillar and pharynx, and herpes simplex virus, anterior part of the oral cavity. Which is not a cause of white appearance of white lesions of mucosa? Keratinization, imbibition of fluid, pigmentation, coagulation of surface. Pigmentation is not the cause of white. Lady reported with non-tender expansile lesion extending from 2.3 to 2.6. Histopathology showed multiple ossified areas, fibrous stroma, dispersed trabeculae, and peripheral rimming of bone. This is cemento-ossifying fibroma. Which of the following had been reclassified under tumors? Calcifying odontogenic cyst. This has been reclassified under tumors. A patient presents with non-tender indurated mass in left submandibular region. On examination, pus shows yellow granules and foul smelling. Fungal hyphae is also seen. It is Actinomyces israeli. A benign neoplasm that commonly appears as non-painful, slowly enlarging, soft mucosal lump and has overlying epithelium that often exhibits pseudoepitheliomatous hyperplasia. It is a gingivitis granuloma, granular myeloblastima, aberrant sebaceous gland. Submucosal lump slowly enlarging. It is a granular cell myoblastoma. Yellowish discoloration of oral mucous membrane, skin and sclera of the eye. It is characteristic of carotenemia, sickle cell anemia. But sclera is not involved in carotenemia. So in question it is mentioned sclera also. Hence excessive bilirubin destruction like in sickle cell anemia leads to involvement of the sclera. Identify the condition. More or less marginal gingivitis is present, commonly seen in HIV infected patients. LGE, linear gingival erythema, is a non-plaque induced gingivitis. Okay. HIV infection is known to be transmitted during all of the following except breastfeeding, childbirth, heterosexual intercourse, kissing. In kissing, the HIV doesn't transmit. Another name of odontogenic keratocyst is primordial cyst, calcifying odontogenic keratocyst, keratocystic odontogenic tumor, keratinizing epithelial odontogenic cyst. C is the correct answer, keratocystic odontogenic tumor. That's all for today's MCQs practice. I'll see you again in the next video.